ꯑꯩꯈꯣꯏꯒꯤ dependence ko adegi amana addiction gi matang da happy yengkhre bo ko ngasi class mainly yengadorishna aikogi effect of drug and alcohol abuse ki matang ni yengadori ne bo ko. So the immediate adverse effect of the drug and alcohol abuse are manifested in the form of reckless behavior ko. Kudak ki oiba kay gumana nga sa drug si sinaba haure na hayre se bo ko. Kogi user mana aduda ahan bala kada base kudak ki oiba dinang reckless behavior ko magi behavior the changes mamala aneba. Adagi reckless hayre afa mong da te bo ko pata mong da la kadori ne bo ko. Adagi amana vandalism ko thuga ye khaiba makhorani violence ko ananga sagi mi geta khana chaina ba du oda am hor kadoi ne bo ko. Adagi excessive dose of drug may lead to coma kai kuma nanga sagi drug to excess hoina chajan ki taksan ki ta agadi coma lak pi and even nanga sagi death fo oi bi ai bo ko kai gi nanga sagi respiratory failure gumba lak pana maram moidana natraga heart failure natraga cerebral hemorrhage ko cerebral hemorrhage haita agadi koi brain manung nanga sagi koi gi e gumba thokpo khotpo oi gadori ne bo ko e gumba clotting clot te kang to boi de ne bo ko combinations of drug or their intake along with the alcohol generally resulting in overdosing and even then ngasagi man zari bu drug to ga kana ga combine to khugi ba ngasagi alcohol gumba combine to khibana maram moide ngasagi buko drug to overdose even me to see buga yai cinema na sita hai se buko. The most common warning sign of the drug and alcohol abuse among the youth included drop of academic. Okay, kay gumba ngasagi satra da oiragana kari kari effect lakpuno cinema hai se buko. Number one, the Nagasaki academic performance Hantarani, exam Gumbada fail over Kotpa Goma and the Tina Hantana Pangba Kotpa, Adugu Minor Lady, school Gumbada College Gumbadagi Nagasaki, Maram Sad and FCN over Kotpa. Adagi personal Masa Lunan Baga Laru Davane Boko, Masang with the Sang Hako, Hora Davani, Cousin the Sang Sang Hako Hora Davane Boko, personal hygienic to Bango the later Rueva. I don't know me having a Samyam Sang Hakan and Neguriza Mali, Nika and Harido. Magi personal hygienic like the beginning of interest can the treva. The American withdrawal, the isolation, depression, fatigue, aggressive, and nangasagi rebellious behavior. Deterioration relationship with the family and a friend, loss of interest in hobbies, kumba, the change in sleeping and eating habitat, fluctuation in the weight and appetite, etc. etc. So, ma'am, lay a book. Saturday, yung higher the point number one, they got the academic performance. Ani subadar nanga sagi college school lung madagi absent way boko maram isa sadana personal hygienic kuma mga da loss pa withdrawal ko nanga sagi mana tawriba yamna interest rate thabu ka mana ita thadu ko tokpa yamna tawro po kolak ka adagi isolation hay gadi mas ha matom da mathanta ga laiba ko mathanta laiba ka hainarak ba khonarak pa duguma lakadaini depression guma ko matha sa ba kot pa ga lakadaini sokta wan tha ba ga lakadaini and then even aggressive ko hay gadi isaw yam langan ba ko gan ba ga lakadaini bo ka adagi rebellious behavior hairagadi hadi laman khumning ba khoning ba ko man si ai bia bra ai duni dani ga ne yamna lakadori ne ba ko rebellious behavior adagi magi friend am magi family ga na sa gi relationship se faroi de ne ko mama na baga tina khona da na le kadori ni family gi mi ga yana da na khona da na le kadori ni and then na sa gi amana ga no loss of interest in hobbies kum da ko hobby mana tawjaram hobby me amado mana kesu pangthora ro ye bo ko adai nang si tumba zaba matam si zo mak khinani mayam chak samina ngai daga chada bi da tonga na ma mathanta ka mak ko na ma sabu khot pa dugum bala ka dori ne bo ka adagi amana nang sagi fluctuation weight ka se bo ka ama henga ama hantha sumai nyam sana ga doi ni adanga sagi appetite ka se bo ka ama na khangcha zaba ama na maka sukcha za da khota ba sugumba mayam lak pi ai sine bo ka there may even be far-reaching implication of drug or alcohol abuse. Ko ma'am, like if abuser is unable to get money, sidagi na sati graba la yesine boko drug and alcohol abuse ka musing se boka. Kay guma pa wale na hire se magi drug na drug alcohol do lay na bagita magta. Ado makoy na nga sa pisa ka huran bukolan sinti guma tawro kadoy neba. The adverse effect is not just restricted to the person who are using the drug or alcohol. At the time, drug ko man hai si mat mathan khakta wa ba khat pa khatna te bu ko ma amasu la ka do ye bu ko nanga sai gi drug or alcohol addict we mi jo nanga sai gi bu ko mental as well as financial distress am bi ga do ni ma gi family member am sung ma gi friends da bu ko hai ga do ni nanga sai ma cha da na hura lo re ha se bu ko ma cha do khakta na te drug sa ba ma cha do khakta na te ba wa ga do si ꯑꯗꯩ ꯃꯥꯒꯤ ꯇꯤꯟꯅꯕ ꯃꯃꯥꯟꯅꯕ ꯑꯗꯩ ꯃꯥꯒꯤ ꯏꯃꯨꯡ ꯃꯅꯨꯡꯁꯨ ꯑꯗꯨꯝ ꯄꯨꯂꯞ ꯋꯥꯃꯤꯟꯅꯒꯗꯧꯔꯤꯅꯦꯕꯀꯣ ꯁꯤꯅꯦꯕ ꯃꯥꯅ ꯍꯥꯏꯔꯤꯁꯤꯀꯣ ꯃꯥ ꯃꯊꯟ ꯈꯛꯇ ꯋꯥꯒꯗꯕ ꯅꯠꯇꯦ ꯃꯌꯥꯝꯁꯨ ꯆꯦꯟꯅꯔꯛꯀꯗꯧꯔꯤꯅꯤ ꯁꯤꯅꯦꯕꯀꯣ ꯃꯥꯅ ꯁꯤꯗ ꯍꯥꯏꯅꯤꯡꯉꯤꯁꯦ those who take drug intravenously ꯅꯪ ꯉꯁꯥꯏꯒꯤ ꯁꯤꯡꯂꯤꯗ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯥꯞꯄ ꯂꯩꯗꯅ ꯑꯗꯨꯒꯨꯝꯕ ꯀꯥꯡꯕꯨ ꯅꯝꯕꯔ 4 ꯀꯥꯞꯄ ꯀꯥꯡꯕꯨꯁꯤꯡꯒꯤꯅꯦꯕꯀꯣ ꯁꯤꯗꯅ ꯑꯃꯨꯛꯀ direct injection into the vein ko using the needle natraga syringe are much likely to acquire serious infection like AIDS kumba hepatitis B kumba na bai chang yam wangi boko na sai gi singdi da drug inject to kangu gi de boko virus mayam su kamai to buno ay kadi ing sep ko the viruses which are responsible for this disease are transferred from the one person to another by the sharing of infected needle and syringe na sai gi infected needle kumba hari na AIDS na ba mi amaga singdi do mana yetum no tinaru taragadi nanga saigi sunana ramdaba mi de sudum na ba ya sinebuko mana sida haise both AIDS and HIV infection are chronic and sathi banebuko even mi ru CB ya isineba but nanga saigi buko hoi mana nanga sai sirin share to dragasu atopa lambi amada su kedo biya buko transmit to biya na hairame buko hepatitis B gumba AIDS gumba se mana nanga sai sexual contact gumba de nanga saigi infected blood kumba caption caution gi biya taragadi na bi jang yang wang yeboko the use of alcohol during adolescence may even as long term effect mamusu lay biya ko it led to the heavy drinking in the nanga sagi adulthood hayeng mana angang oing da yu do khara khari thakam mani ado adult ore kan di amaka hena consume tarok pagi jang si am wang na layeboko adagi the chronic use of drug and nanga sa alcohol sina nanga sagi nervous system sida problem la ka do ni mi do nanga sa nervous system once problem la kita ragadi angau phai do men tor ka do ni boko even liver gumbagi liver cirrhosis gumbada su nanga sagi problem o helak bi ai boko liver cirrhosis hai ta ragadi liver damage to ba adugumba makhan gi laina amane boko the use of drug and alcohol during the pregnancy matam sida nanga sagi alcohol gumba drug gumba sina taragadi magi pokadaba macha tu nanga sagi effect fataba effect mayam lakani sine ko man sida hermisa ate to pa khara yeng si drug ko nanga sagi both male and female the drug sina rubana kari kari akai balak puno haibegi matang da mayeng si another misuse of drug is what certain sports person do to enhance their performance ko nanga sagi ꯑꯩꯈꯣꯏꯒꯤ ꯁ꯭ꯄꯣꯔꯠ ꯄꯥꯔꯁꯟ ꯁꯥꯟꯅꯔꯣꯏ ꯀꯥꯡꯕꯨꯁꯤꯡꯁꯤꯅꯕꯨꯀꯣ ꯃꯣꯏ ꯄꯔꯐꯣꯔꯃꯦꯟꯁ ꯍꯦꯟꯒꯠꯅꯕꯒꯤꯗꯃꯛꯇ ꯑꯇꯣꯞꯄ ꯗ꯭ꯔꯒ ꯈꯔ ꯁꯤꯖꯤꯟꯅꯕꯁꯨ ꯂꯩꯌꯦꯕꯀꯣ ꯗꯦ ꯌꯨꯁ ꯑꯣꯏꯕ ꯌꯥꯏ ꯃꯤꯁꯌꯨꯁ ꯑꯣꯏꯕ ꯌꯥꯏꯀꯣ ꯅꯥꯔꯀꯣꯇꯤꯛ ꯑꯦꯅꯥꯜꯖꯦꯁꯤꯛ ꯍꯥꯏꯅ ꯍꯥꯏꯔꯒꯗꯤ ꯅꯥꯕ ꯐꯅꯕ ꯍꯤꯗꯥꯛ ꯀꯣ ꯇꯧꯕꯇꯕꯨ ꯅꯪ ꯉꯁꯥꯏꯒꯤ ꯅꯥꯔꯀꯣꯇꯤꯛꯄꯨ ꯄꯟꯖꯜꯂꯛꯄ ꯇꯥꯔꯒꯗꯤ ꯑꯦꯗꯤꯛꯇꯤꯛ ꯅꯦꯆꯔ ꯆꯦꯟꯕꯀꯣ ꯑꯦꯗꯤꯛ ꯑꯣꯏꯕ ꯑꯦꯗꯤꯛꯇꯤꯛ ꯅꯦꯆꯔ ꯑꯣꯏꯕꯀꯣ adagi anabolic steroids kaina leiriyeboko adagi diuretic sina amaka kamhain tawba drug no hairagadi akhoigi kari neboko weight handanaba akhoigi hidak neboko weight reducing drug ama oigadaiba nangna ADH ki tawba function do adugi direct opposite neba lakadori seboko this is opposite to ADH okay adu nanga sagi aksang de ising je urine weight sida nga sagi aksang je ka bain tawni various kind of chemical reaction ama cha thala kadoi ni various kind of chemical reaction dana maram moidana nanga sagi bu ko water generate to the aksang de urine gi through remove to gidoi ne bu ko aduga weight to handhala kadoi ba adagi are the certain drug kharam sulai bu ko nanga sagi sports person sinar kana magi muscular strength gumba adagi bu ko hengalan pa adagi ko and bulk ko muscle chawhalakpa khorhalakpa adagi nanga sai aggressiveness gumba ko sports sanaroi mi oiba oiga taragadi aggressiveness is amag darkar oibo ko safu am yawdu taragadi mana tawgada sports to da fajana performance like tabi yai sine ko sida mana sida palamisa and result increase in athletic performance henganabagi dabaktani mo scenery duna buko side effect am yeng se buko anabolic steroid singi sinar buta agadi female sida side effect khare lai khare tanate khare yama kadori ne buko masculinization ko sina maka muscle gumba develop tor ko nupa dawna muscle ka kadori ne ba female sida ba adagi aggressiveness ama hengala kadori ne ko mood swing la kadori ni depression even nang asai menstrual cycle for normal oro oyebo ko adagi excessive hair loss ko hair growth loss na de growth ko sanga se body gi hawroi da ba area daga mai mi taga nupi de yengo ba mamai mi ta masam hawgala ga di bera ka kanebo ko face region daga nanga sai body daga adagi clitoris na nanga sai gi female gi koi gi reproductive organ am ogidoi ne bugo sigase normal dagi hen enlarge to chauthor kadoi ne bugo adagi magi voice kasi deep oirakpa female di voice kasu deep oidedana nanga sai gi bugo female da kai gum anabolic steroid sina bata ga male gi type ta makhon ga deep oijalak pi ya isine male dana amaka kai no ming se buko male dana nang na se acne gum lakpa ko adai nang ma se aggressive hengala ni mood swing la ni depression adai nang sa gi testicle hai di testis tu ne buko ado ma gi size ka handarak pa testis size handarak pa dara ga di nang sa gi sperm production tu handarak ga dori ne ba na adagi atai atopata na kidney gumba liver gumba se nang sa mathau toru oi dei ne buko dysfunction ai tari mathau phajan torok ta buko adagi nupa daga breast enlargement la khalak pi ai adagi buko matam zadana mako ka tangjalak buko premature baldness adagi prostate gland ga si chawkhalak pi ai ko so this effect may be permanent oi pi ai buko with pro kai kumana nga sai drug to kuina sang sina taragadi in adolescence male and female sharps ko severe facial and body acne and a premature closure of the growth center of the long bone may result in the stunted ko nanga sai gi both male and female da common oi ba hairaga di nanga sai gi buko mamaida natraga tai magi body part acne thorok ko acne hairaga di khoi gi pugri makhan amane buko adi mamaida yerom ke kang thongak pokholak badu mena la khadoi ne buko adi nanga sai gi saru sida buko khoi epiphyseal ena epiphyseal plate ena mala ye buko sumaina epiphyseal plate si close tauba open tauba le buko nanga sai gi childhood matam dadi nanga sai epiphyseal plate si open tauba dei ne open tauba da ga di nanga sai gi khoi gi kai sa saru se sangdora khadoi ne buko ada epiphyseal plate si nanga sai gi adult dadi amaka close tau khre buko close tau gi da ga di nanga sai saru du sangdo pi ara roi adu bu nanga sai gi drug ko masina da ga di epiphyseal plate si dak launa close tau jan khine buko nanga sai gi growth kala khala oi dori ne buko sugum basi tum thengna bi ai ko adu ta ga di magi growth ko malai ta ko lakta sugum mayam se lak pi ai buko okay si prevention and control pa tangai ko okay okay yare ko prevention and control da mai yeng se ko kamain tor kan na sai drug or alcohol abuse kamain tor ke khoi prevent to godoi no ade kamain tor control to godoi no haibi gi matang ma oi godoi ne ko the all ko the all is ko it is of kani man it is na ma hapam ni ko sentence mata ma chik to gi ko o prevent nam sumna hai ba ama leiram mi asine ko man hai se ko thaina ahalaman jeng na koina khoida hairam ba ma lei ko prevention is better than cure hai do ko cure do phangdringai de prevention hana to hu bane hena phai asine ba moina hai se ko whole true here also sida suna nga sai gi drug abuse ki case sida so sigi akhoi gi prabhav se dum sinabi ya isine ko it is also true that habits such as smoking gumba taking drug and alcohol are most likely taken up by the young age ko ayamana hawing idon hoina han sinaba hawe ko more during the adolescence matam dana ayamba heli sine ko pitru pik pangang chahi manga tara nadi kaisu sina roi ko nanga sagi adolescence matam da leiba naha sing china hena sina ka doi ne ko hence it is best to identify the situation that may push an adolescent toward the use of drug and alcohol and take the remedial measure well in time man hai kari gino man drug sina ba hore ise kai gino alcohol sina ba hore ise sigi proper reason ma hana khoina khangdo hobun hena phai sine man sta hai se boka aduga chap chana ba remedial measure ma khon lakhol hobu taragadi hariba naha singse drug amsong alcohol abuse tagi prevent do ya khani sinema hai se boka in this ground the parent and the teacher must have a special responsibility ko ma singa magi parent amsong magi teacher sing siki special responsibility amasu lei sin hai se boka parenting that combines with a high level of nurturance and a consistent discipline has also been associated with a low risk of nangasagi substances like alcohol, drug, tobacco abuse. Nangasai ko na parenting to matam da masaga to toina ka check to raba kari chari no kari thai no karma mama na ba puli no ꯀꯔꯤ ꯇꯥꯏꯃꯤꯡꯗ ꯍꯜꯂꯛꯄꯅꯣ ꯀꯔꯤ ꯇꯥꯏꯃꯤꯡꯗ ꯊꯣꯛꯄꯅꯣ ꯈꯣꯠꯄꯅꯣ ꯁꯤꯒꯨꯝꯕ ꯃꯌꯥꯝꯁꯤꯅ ꯆꯤꯡꯕꯁꯦ ꯑꯩꯈꯣꯏꯅ ꯆꯦꯛꯁꯤꯟꯅ ꯃꯥꯒꯤ ꯄꯦꯔꯦꯟꯁꯤꯡ ꯅꯠꯇ꯭ꯔꯒ ꯃꯥꯒꯤ ꯇꯤꯆꯔꯁꯤꯡꯁꯤꯅ ꯌꯦꯡꯖꯟ ꯊꯤꯖꯟꯕ ꯇꯥꯔꯒꯗꯤ ꯁꯤꯒꯨꯝꯕ ꯁꯕꯁꯇꯦꯟꯁ ꯑꯦꯕ꯭ꯌꯨꯁꯦꯁꯁꯤꯡꯁꯤꯗꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯄ꯭ꯔꯤꯚꯦꯟ ꯇꯧꯕ ꯌꯥꯏ ꯑꯃꯁꯨꯡ ꯉꯁꯥꯏꯒꯤ ꯍꯥꯏꯔꯤꯕ ꯁꯥꯇ꯭ꯔ ꯅꯠꯇ꯭ꯔꯒ ꯑꯉꯥꯡꯗꯨꯅ ꯉꯁꯥꯏꯒꯤ ꯁꯤꯒꯨꯝꯕ ꯁꯕꯁꯇꯦꯟꯁ ꯁꯤꯖꯤꯟꯅꯕꯗꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯀꯜꯍꯧꯕ ꯌꯥꯏ ꯁꯤꯅꯦꯕꯀꯣ ꯌꯥꯝꯅ ꯃꯥꯡꯖꯧꯅꯅ ꯑꯗꯒꯤ some of the measures mentioned here would be particularly useful for the prevention and control of the alcohol and drug abuse among the adolescents. Makada mana khara piriyeboko preventive measure khara amsung control measure khara asisi follow to badaragadi akoina naha singse drug amsung alcohol abuse to badagi akoina kanbe yai cinema na sida palisi ko. Number 1, the avoid undue pressure ko peer pressure gumba nanga sai pi bese koina hanthan gada boko. Sumna akoina ngang to haigado ko every child has his or her own choice and a personality which should be respected and nurtured. Akoina ngang to hana boko tawba ngamoy da thabuk to di akoina kasu injan ba haroi sine boko magi limit haiba lai ko ngang to mana tawba ngamba akoina pressure nong sir pijan ba khojan ba taw sugum ba si akoina tawoi da bane boko. A child should be pushed unduly to perform beyond his or her threshold limit, be it study or be sport or be other activities or be study tꯧꯅꯕꯒꯤꯗꯃꯛꯇ ꯑꯉꯥꯡꯗꯨ ꯏꯟꯖꯟꯕꯀꯣ ꯑꯗꯣ ꯑꯉꯥꯡꯗꯨꯗꯤ ꯃꯥꯒꯤꯅ ꯄꯥꯕ ꯉꯝꯕ ꯂꯤꯃꯤꯠ ꯑꯃ ꯂꯩꯖꯔꯤꯀꯣ ꯄꯥꯏ ꯍꯥꯏꯔꯀꯥꯟꯗ ꯄꯨꯡ 20 ꯑꯗꯨꯝ ꯄꯥꯕꯗꯤ ꯉꯝꯕꯗꯤ ꯅꯠꯇꯦꯕꯀꯣ ꯑꯗ ꯄꯨꯡ 20 ꯄꯥꯎ ꯈꯣꯠꯂꯨ ꯀꯥꯏꯅ ꯏꯟꯖꯟ ꯈꯣꯠꯆꯟꯕꯗꯣ ꯑꯗꯨ ꯇꯧꯔꯣꯏꯗꯕꯅꯦꯕꯀꯣ ꯑꯩꯅ ꯄꯥꯕ ꯉꯝꯃꯤꯕ ꯂꯤꯃꯤꯠ ꯐꯥꯎ ꯄꯥꯍꯟꯒꯗꯕꯅꯦꯕꯀꯣ ꯉꯝꯗ꯭ꯔꯒꯅ ꯑꯩꯈꯣꯏ ꯇꯧꯊꯣꯛꯄꯤꯒꯗꯕꯅꯦꯕꯀꯣ ꯑꯗꯩꯗꯤ ꯀꯃꯥꯏꯅ ꯇꯧꯔꯅꯤ ꯃꯥꯅ ꯉꯁꯥꯏꯒꯤꯕꯀꯣ ꯄꯥꯕꯗꯨ ꯍꯦꯟꯅ ꯉꯝꯅꯉꯥꯏꯅꯤꯅ ꯑꯃꯨꯛꯀ ꯃꯥꯅ ꯇꯨꯝꯅꯤꯡꯗꯅꯉꯥꯏꯒꯤꯅ ꯁꯤꯒꯔꯦꯠ ꯁ꯭ꯃꯣꯀꯤꯡꯒꯨꯝꯕ ꯀꯣ ꯇꯣꯕꯥꯀꯣ ꯁ꯭ꯃꯣꯀꯤꯡꯒꯨꯝꯕ ꯅꯠꯇ꯭ꯔꯒ ꯑꯇꯩ ꯑꯇꯣꯞꯄ ꯁꯤꯟꯅꯕ ꯁ꯭ꯄꯣꯔꯠꯁ ꯄꯥꯔꯁꯟꯁꯤꯗꯁꯨ ꯉꯝꯗ꯭ꯔꯦꯅ ꯍꯥꯏꯔꯦꯅꯦ ꯃꯥꯒꯤꯗꯣ ꯁꯤꯗꯒꯤ ꯁꯤꯐꯥꯎ ꯃꯥ ꯆꯦꯟ ꯆꯣꯡꯕ ꯉꯝꯗ꯭ꯔꯦꯅ ꯍꯥꯏꯔꯦꯅꯦ ꯑꯗꯨꯗꯗꯤ ꯄ꯭ꯔꯦꯁꯔ ꯄꯤꯖꯜꯂꯛꯑꯅꯤꯅꯦ ꯃꯥꯒꯤ ꯀꯣꯆꯇꯨꯅ ꯅꯪ ꯁꯤꯐꯥꯎ ꯉꯝꯗꯕ ꯈꯣꯠꯇꯕ ꯑꯗꯨ ꯑꯗꯥ ꯀꯥꯏꯅ ꯍꯥꯏꯔꯛꯀꯗꯧꯔꯤ ꯑꯗꯨꯗꯤ ꯁ꯭ꯄꯣꯔꯠꯁ ꯁꯥꯟꯅꯔꯣꯏꯗꯨꯅ ꯑꯃ ꯀꯃꯥꯏꯅ ꯇꯧꯅꯤ ꯃꯥ ꯗ꯭ꯔꯒ ꯁꯤꯖꯤꯟꯅꯔꯅꯤ ꯃꯥꯒꯤ ꯄꯔꯐꯣꯔꯃꯦꯟꯁ ꯍꯦꯟꯒꯠꯅꯕꯒꯤ ꯑꯗꯨꯗꯤ ꯀꯩꯝꯇ ꯀꯥꯟꯅꯔꯔꯣꯏ ꯁꯤꯅꯦꯕꯀꯣ ꯑꯗꯩ ꯑꯗꯔ ꯑꯦꯛꯇꯤꯚꯤꯇꯤꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯄ꯭ꯔꯦꯁꯔ ꯄꯤꯔꯣꯏꯗꯅꯦꯕꯀꯣ ꯃꯥꯒꯤ ꯂꯤꯃꯤꯠ ꯑꯃ ꯑꯩꯈꯣꯏꯅ ꯈꯪꯕꯗꯣ ꯑꯗꯨꯗꯣ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯟꯅ ꯈꯪꯗꯣꯛꯀꯗꯣꯏꯅꯤ ꯂꯤꯃꯤꯠꯇꯨ ꯃꯣꯇꯤꯚꯦꯠ ꯇꯧꯕꯅ ꯍꯦꯟꯅ ꯐꯒꯗꯧꯔꯤꯅꯦꯕꯀꯣ ꯑꯗꯨꯒꯤ ꯃꯍꯨꯠꯇ ꯄ꯭ꯔꯦꯁꯔ ꯄꯤꯕꯒꯤ ꯃꯍꯨꯠꯇꯗꯤꯀꯣ ꯑꯗꯒꯤ education and counseling pibako. Education and counseling him or her to face problem and stress and to accept the disappointment and the failure as a part of life. Mana hai ko egoina education counseling sina lakadarisina akoigi ꯃꯤꯑꯣꯏꯕ ꯑꯃꯅ ꯅꯪ ꯉꯁꯥꯏꯒꯤ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯀꯃꯥꯏꯅ ꯇꯧꯔꯒ ꯍꯦꯟꯗꯜ ꯇꯧꯒꯅꯤ ꯍꯥꯏꯕꯁꯤꯁꯨ ꯇꯥꯛꯄꯤꯒꯗꯕꯅꯦꯕꯀꯣ ꯑꯗꯨꯅ ꯉꯁꯥꯏꯒꯤꯕꯀꯣ ꯃꯁꯥ ꯃꯊꯟꯇ ꯁꯣꯜꯕ ꯇꯧꯕꯒꯤ ꯃꯍꯨꯠꯇꯗꯤ ꯅꯪ ꯉꯁꯥꯏꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯀꯃꯥꯏꯅ ꯇꯧꯔꯒ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯗꯨ ꯁꯣꯜꯕ ꯇꯧꯒꯅꯤ ꯍꯥꯟꯅ ꯑꯦꯗꯚꯥꯏꯁ ꯑꯃ ꯄꯤꯕ ꯌꯥꯏꯀꯣ ꯅꯠꯇ꯭ꯔꯒ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝꯗꯨ ꯁꯣꯜꯕ ꯇꯧꯕ ꯉꯝꯗ꯭ꯔꯦ ꯍꯥꯏꯔꯒ ꯑꯦꯁ ꯑꯩ ꯉꯝꯃꯔꯣꯏ ꯑꯩ ꯁꯤꯒꯤ ꯒꯨꯂꯤ ꯁꯤꯒꯤ ꯅꯝꯕꯔ 4ꯁꯤ ꯀꯥꯞꯄꯅꯤ ꯒꯨꯂꯤꯁꯤ ꯆꯥꯔꯅꯤ ꯀꯥꯏꯅ ꯃꯥꯅ ꯇꯧꯊꯣꯛꯈꯤꯕ ꯇꯥꯔꯒꯗꯤ ꯀꯃꯥꯏꯅ ꯇꯧꯒꯗꯕꯅꯣ ꯍꯥꯏ ꯇꯥꯔꯒꯗꯤ ꯐꯠꯇꯕ ꯔꯣꯝꯗ ꯆꯪꯁꯤꯜꯂꯛꯀꯗꯧꯔꯤꯅꯦꯕꯀꯣ ꯑꯗꯨꯅ ꯑꯁꯤꯒꯨꯝꯕ ꯄ꯭ꯔꯣꯕ꯭ꯂꯦꯝ ꯍꯦꯟꯗꯂꯤꯡꯁꯦ ꯁ꯭ꯇ꯭ꯔꯦꯁ ꯍꯦꯟꯗꯂꯤꯡꯁꯦ ꯃꯈꯣꯏꯗꯁꯨꯅ ꯉꯁꯥꯏꯒꯤ ꯇꯧꯍꯟꯒꯗꯣꯏꯅꯤ ꯑꯗꯩ ꯀꯩꯒꯨꯝꯕ ꯐꯦꯜ ꯑꯣꯏꯔꯦ ꯍꯥꯏꯔꯦꯅꯦ ꯊꯕꯛ ꯑꯃꯗ ꯃꯥꯅ ꯑꯗꯨ ꯑꯩꯈꯣꯏꯅ ꯍꯥꯏꯒꯗꯣꯏꯅꯦꯕꯀꯣ ꯐꯦꯜ ꯑꯣꯏꯕꯁꯤ ꯀꯩꯝꯇ ꯅꯠꯇꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯄꯥꯔꯠ ꯑꯣꯐ ꯂꯥꯏꯐꯅꯤ ꯐꯦꯂꯔꯒꯤ ꯃꯊꯪꯗ ꯁꯛꯁꯦꯁ ꯂꯩ ꯐꯦꯜ ꯑꯣꯏꯔꯤꯗꯨ ꯀꯩꯅꯣꯅꯦ ꯑꯦꯠꯂꯤꯁ ꯅꯪꯅ ꯇ꯭ꯔꯥꯏꯕꯨꯗꯤ ꯇꯧꯋꯤ ꯑꯗꯨꯅ ꯍꯦꯟꯅ ꯚꯦꯂꯨ ꯑꯣꯏ ꯏꯝꯄꯣꯔꯇꯦꯟ ꯑꯣꯏ ꯀꯥꯏꯅ ꯃꯣꯇꯤꯚꯦꯠ ꯇꯧꯕꯤꯕ ꯈꯣꯠꯄꯤꯕ ꯑꯃ ꯆꯪꯉꯦꯕꯀꯣ it would be worthwhile to channelize the child energy into the healthy pursuit like the sports reading adagi na ngasagi music yoga and other extracurricular activities mayam amadabo sport sanaba oibi pabu oibi music oibi yoga other extracurricular activities mayam leibako sugumbadana hena thajan bana phagani sinebako laik haraga da dum laik da dum focus tawon ba yaroi satra duna ngamda taragadi sinebako man harise if ngamba taragadi oibi ma dum magi thokpa to hanbe ngamda taragadi sugumba activities mayam sing sida thajan bana hena phagani sineba seeking the help from the nangasai parent and a peer ko nangasai gi magi tineriba marup natraga boko magi parents sing sidagi mateng lowba hai tare boko afaba mong da ko help from the parents and peers should be sought immediate so that they can kanano guide appropriately ko man chana boko magi problem ama oigera boko magi parent natraga magi peer ko magi friends sing sidagi boko ꯑꯩꯈꯣꯏꯅ ꯉꯁꯥꯏꯒꯤ ꯃꯇꯦꯡ ꯂꯧꯕ ꯈꯣꯠꯄ ꯁꯤꯒꯨꯝꯕꯁꯤꯁꯨ ꯈꯔ ꯇꯧꯒꯗꯕꯅꯦꯕꯀꯣ help may be even sought from the close ꯅꯠꯇ꯭ꯔꯒ trusted friend ꯗꯒꯤ ꯑꯣꯏꯅ ꯂꯧꯒꯗꯕꯅꯦꯕꯀꯣ ꯃꯇꯦꯡ ꯂꯧꯕ ꯍꯥꯏꯔꯒꯕꯨꯀꯣ ꯑꯩꯒꯤ ꯂꯨꯗꯕ ꯏꯃꯥꯟꯅꯕ ꯑꯩꯅ ꯍꯦꯟꯈ꯭ꯔꯅꯦꯅ ꯄꯥꯈꯠꯄ ꯏꯃꯥꯟꯅꯕꯗꯨꯗꯒꯤꯗꯤ ꯃꯇꯦꯡ ꯂꯧꯔꯒꯗꯤ ꯀꯩꯁꯨ ꯑꯐꯕ ꯁꯖꯦꯁꯟ ꯇꯧꯔꯛꯑꯣꯏ ꯁꯤꯅꯦꯕꯀꯣ ꯐꯠꯇꯅꯕ ꯂꯝꯕꯤꯗ ꯑꯣꯏꯅ ꯏꯟꯓꯜꯂꯛꯀꯅꯤ ꯁꯤꯅꯦꯕꯀꯣ ꯇ꯭ꯔꯁꯇꯦꯠ ꯑꯣꯏꯕ ꯃꯤ ꯑꯃꯗꯒꯤ friend oigera natraga close oiba mi amadagi lawgudinebako. Besides getting proper advice to sort out their problem, this would help the young to vent their feeling and anxiety and agil nanga sagi fazana nanga sagi friend duga natraga magi parent duga discuss tawhrene problem am solve tawnabagi damakta adudagi nanga sagi problem do once solve tawhib taragadi mana nanga sagi boko guilty gumba feel dawrpo kholakpa anxiety gumba feel dawrpo kholakpa singdona mana nanga sagi ngakthoknaba ma mating am oigani sinebe koina haigadawise boko adigi and then looking for a danger sign go danger sign kari kari leibno amasung danger sign leiba taragadi kanada report tawgani haibi matang neboko. Alert parent and the teacher need to be look for and identify the danger sign discuss aba mathakta paliba danger signs if kaigumba thengna taragadi angang na problem na pi natraga stress adugumba sugumba ma'am thengna taragadi parents sing amsu magi teacher sing sina buko khutakta hariba mi dugi mayok naraga magi problem to solve tawna ba khona ba changdan gada ba ne sine buko even nanga sagi friend if they find someone using drug or alcohol should not hesitate to bring this to notice to the parent or the teacher in the best interest of the person concerned. Nang kay gumanang namanabi do nang thengnaraba drug natraga alcohol gumba sinaba taragadi nang nangasagi magi parent ikoina ko khutakta haidare boko as my parent hairaga na imanaba na lana khan khidra khot khidra mana warau khidra gaina adugumba mayam do khandabida boko hekta thuna report to hogadabane boko adagi and then appropriate measure would then be required to diagnose the malady serious problem haibane boko malady hairagadi ko bamang da sum haikre boko and underlying the cause sumna khudak report to hobata ragadi angang dugi problem do kari no khona hanu thuna khangau ne boko problem do nanga sai khangau ragadi immediate nanga sai gi solution ama purok si yai sinebo this would have the initial proper remedial step for the treatment sinebo ko ma hoji haise adu seeking professional and medical help sisina last oiba kari oigidori nebo ko man nanga sai gi alcohol amsung drug abuse ko ne prevent tawbagi ko a lot of help is available in form of highly qualified psychologists, psychiatrists, and nangasagi de-addiction and rehabilitation program to help the individual who were unfortunately got into the quagmire of the drug or alcohol abuse. Nangasagi if drug natraga alcohol abuse nang si changjalure hairne sigi fataba lambi sida fataba lambi sida changjalu taraga subu ko even nangi parent mak tak thok traga subu ko sugmene am hai singlaba ꯑꯩꯈꯣꯏꯒꯤ psychologist ꯂꯩꯔꯤ psychiatrist ꯂꯩꯔꯤ ꯀꯣ ꯃꯈꯣꯏꯗꯤ ꯃꯇꯦꯡ ꯂꯧꯕ ꯌꯥꯏꯑꯕ ꯁꯦꯡꯅ ꯍꯥꯏꯔꯨꯔꯒꯗꯤ psychologist psychiatristꯀꯤ ꯃꯈꯣꯏꯅ ꯄꯤꯔꯛꯄ ꯃꯇꯦꯡꯁꯤꯗꯤ ꯃꯈꯣꯏꯗꯤ ꯇ꯭ꯔꯦꯟ ꯑꯣꯏꯔꯕ ꯃꯤꯅꯦꯕꯀꯣ ꯃꯤꯁꯤꯒꯤ ꯋꯥꯈꯜ ꯀꯔꯤꯅꯣ ꯀꯃꯥꯏꯅ ꯇꯧꯔꯒ ꯈꯜꯂꯤ ꯃꯥꯒꯤꯁꯦ ꯐꯠꯇꯕ ꯋꯥꯈꯜ ꯈꯜꯂꯛꯏꯁꯦ ꯀꯔꯤꯒꯤꯅꯣ ꯑꯐꯕ ꯋꯥꯈꯜ ꯈꯜꯂꯛꯇ꯭ꯔꯤꯁꯤꯅ ꯀꯔꯤꯒꯤꯅꯣ ꯀꯥꯏꯅ ꯃꯈꯣꯏꯗ ꯐꯖꯅ ꯇ꯭ꯔꯦꯟ ꯇꯧꯔꯀꯥꯟꯗ ꯂꯩꯔꯕ ꯃꯤꯅꯦꯕꯀꯣ ꯃꯈꯣꯏꯗꯒꯤ ꯂꯥꯛꯄ ꯃꯇꯦꯡꯗꯨꯗꯤ ꯍꯦꯟꯅ ꯐꯒꯗꯧꯔꯤꯅꯦꯕꯀꯣ ꯑꯗꯨꯅ ꯃꯈꯣꯏꯒꯤ ꯃꯇꯦꯡ ꯂꯧꯍꯧꯕꯅ ꯍꯦꯟꯅ ꯐꯩꯌꯦꯕ which has helped the affected individual with the sufficient effort and willpower can get rid of the problem completely and lead to the perfect normal and healthy life nangasai mating si lawr matung de khun nangasai gi perfect life ma dum hingbi ai sine ko sigi phattaba nangasai gi drug amsung alcohol abuse ki problem si dagi nan thu aka de khun perfect life ma hingbi ai sine ko even nangasai gi nupi kainari na hairasu exam fail ori na hairaga su ko nangi parent na counseling pi bodo nang na satisfy oida taragadi sida paliba nangasai gi professional kangu singse sida nang amuk changchan bi ai ba if nang drug charori ne drug thaduk pangam dre harene adudi nang asai gi ko sugumba hira ba doctor sing sida changchala kanda makhoi rehabilitation center daga layu kholo gaina mating ma'am pirakadori ne boko adu nang asai gi drug amsung alcohol high substance abuse dagi khone prevent do bi ai boko okay sina last point ni kasu NEET point of view idi kasu yam nakana budi important oi de boko council thaga da mi khakta gi wa khatne boko sigi related oi bo question khara solve to gise boko okay next chapter di microphone human welfare of the lakadoi ne boko okay degi sida cirrhosis of the liver is caused by the chronic intake of kana kana sinarubadagi liver cirrhosis lakpunoi so B. Okay, very good. The period between the blank year of the age may be thought to be adolescence period. Adolescence is a brief linking blank and a C, B and a C. The chronic use of drug and alcohol damages the D and E. Alcoholism during the F adversely affect the fetus. Kana we do the option things, eh? ama khakta chummaga loi ka tai loin chummadabani isi oiraneboko. Very good. Adagi and then which part of the brain is involved in the loss of control over okay yare ko sisina ngasagi cerebrum oigadrineboko. Adagi the side effect of anabolic steroid in female sina kari kari laigadriba. Di loinamak yaeboko. Okay, similar layer and then yam kana question budi laite ko adu da ne mana so sita mati ma taw jallaga heta question present or ise boko adegi si statement sima paro yamana boko the correct option kana okay to ne B or D Usikido kai have never B correct statement hari ne boko dependence is the tendency of the body to manifest a characteristic unpleasant withdrawal symptom if abruptly asisina maka kari uti ne boko dependence adegi statement number 2 sipudi ka yare na lawre se boka adagi education adagi sports person often misuse drug to enhance their performance si pasu yare boka education about the harmful effect of the drug and alcohol counseling professional medical would relieve the individual from drug asisi statement number 3 sidi kai problem na you know adagi dependence ki definition si maga okay lo na may yaga to ne boka men may yaga to ne boka number T shi wai ne boka okay, sima leire and then pada okay, sige question number na 196 sima hype kumo ba. Which of the following statement and select the correct answer. Read the following statement and select the correct answer ko. Psycho psychoactive hype ne ko. Kari MLA ama laibani ne. Physical kaina physical active kaina hayam ko ado psychoactive hype ne ko. And the brain ke related brain ke function impair to bungam batrak ne ko. Asi like the budi yaw de ko to correct statement di oil ne ko. Okay, loina hype hero ba di loina may yaga din ne ko. Okay, si bode any discuss to point la regadi hero.